If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to the 9th season of Ask the Doctor. This series was created to assist you in understanding medical issues so you can take charge of your own health. There are two ways to get your questions through. First, by calling in, and the second way is by visiting the website at netny.net/askthedoctor. I'll take those questions for future discussion, or you might see me answer them on my video blog, so keep tuning in. Also, there's a new feature on the website. It's a forum where you are invited to voice your thoughts and opinions on different health topics. I use this medium to talk about issues we don't have time to cover on the show. For example, on there now is something by a Barbara Stevens talking about new health care legislation and flaws that she sees in it. I'm hoping that you read it, and I'm interested in your opinion. Tonight we have a great episode. Tonight I have Dr. Anastasia Nikitina, cardiology attending at New York Methodist Hospital. Next to her, I have Dr. James Scanzo, Chief of Dental and Oral Surgery and Implantology at New York Methodist Hospital. And then we have Dr. Emil Bakash, the Medical Director at Bishop McGovern Center for Geriatric Care and an attending at New York Methodist Hospital. Welcome to all of you, and welcome to all of you out there. It's going to be a great show tonight. We have a cosmetic dentistry, which I know a lot of people are interested in. Dr. Bakash, who's been with us so many times, maybe 10 times, and he stopped. And Dr. Nikitina, who's been with us numerous times, looking beautiful tonight in this outfit, one of our best doctors as well as one of our brightest doctors. So we have in the news that we have to get to. And again, the swine flu, the H1N1 continues to dominate the news in this area. It continues to dominate with myths. Some of the myths are you can get the flu from the flu shot, and this is just not true. The flu shot does not contain a virus, so there's no way you can get it. You may get some irritation, you may get some aches and pains, but it's not the flu, so definitely you want to get it. Number two, that if I get the swine flu vaccine, I'm going to have a miscarriage. It's going to hurt my baby, and nothing could be more false. The baby cannot develop his own antibodies. And this helps him. When you get the shot, it covers you and the baby. And actually, pregnant women are most at risk for the serious events and even death. So what you want to make sure, if you're pregnant, that you don't play around, that you get both the regular flu vaccine and the swine flu. Now, you don't want to get the nasal spray if you're pregnant, because that introduces a virus into the body, and that's something we don't want to do. But remember, if you're pregnant, no fooling around with it. You must get both vaccines. An interesting sidelight, there is a nasal spray, which a lot of people say, I don't want to get the shot, can I get the nasal spray? It's been shown to be only about 30% effective. So it's not as effective as getting the shot itself, so you really can't get away with anything there. You hear also reports about hand washing being overdone. And this may or may not be true. This flu, though, you have to remember, does transmit through touching surfaces. So I don't see how you can overdo hand washing. I mean, even if it's 30% of the time, well, you cut down your chances by 30%, that's still a good percentage. So continue to wash your hands. There have been some Tamiflu resistance. Now remember, Tamiflu is the pill that you take that stops the virus from reproducing in the body. As we see in Europe, and people are overusing it, there are resistant cases now of the swine flu to the Tamiflu. So again, it just points to the need to use it judiciously, not to take it when it's not necessary, and only to take it under the care of your doctor. I know it's available on the internet, and you can get it from friends and so on. You don't want to take it unless you absolutely have to. So that's some of the swine flu information. And one other thing, we're going to be looking very carefully at people who've had the swine flu and then any reactions they might, the swine flu vaccine, and then did it cause any reactions? For example, some people say it caused my heart attack or caused me to have a miscarriage. And these things are normal events that go on anyway. And if you vaccinate enough people, by coincidence, you're going to find people who do have a heart attack or do have a problem. And it's being closely watched to make sure that it is just a coincidence. And right now, the vaccine is proven to be totally safe. So go out there and get it. It should be coming in the next 2 weeks. So now let's get to our quiz. I know the quiz is, which U.S. president has had the most number of towns and cities named for him? Now, which U.S. president has had the most number of towns and cities named for him? I know last week they threw the answer up there and they still didn't get it for a half hour. So we're hoping that you pay attention to this question. And there's a great prize, as we know, the plaque. You don't want to miss that plaque. Only nine in existence. We're going to come back. We're going to take our first call. I see it's flashing. I don't know if it's Maddie, Joel, or maybe a newcomer to the first call. And then we're going to talk a little bit about what our guests are up to. So the number to call is 718-499-6101. You can call and talk about heart disease, oral health, and geriatric medicine. So let us take a short break, and when we come back, we're going to go right to the phones. The number, 718-499-6101. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics tonight are heart disease, oral health, and geriatric medicine. Now, the number to call is 718-499-6101. And let's get right to our guest. Before I got to acknowledge Monsignor Bennett. Monsignor's been out there. This is our 9th season. He has not missed an episode through rain, shine, no shine because we're always on at night, but rain or snow. Monsignor, thank you very much. Okay, for those who don't remember, Dr. Nikitna, you're a cardiologist. And you deal, what types of things do you see?
Mostly I'm a general cardiologist, so what I'm dealing with on a daily basis with people who has a high blood pressure, high cholesterol, who had angina or coronary artery disease or type of arrhythmias, different types of arrhythmias.
Mostly you treat with pills?
Yes, I'm doing diagnostic tests to find out what exactly wrong, and I'm giving pills.
So we saw you before the summer. And now I know the summer's passed,
Thank you.
I was asking the callers last week what they did for vacation. I understand you went up to New England?
I went to Cape Cod. It was fantastic, actually.
Yeah.
I was biking in the national parks with the kids, and the food is absolutely fantastic there.
Food is tremendous. And
Yeah,
the bike, aren't they nice and flat?
Yeah, it's actually nice.
You don't have to go up the hills. It's
Yeah,
amazing.
I
You
know.
love bike riding. You get no exercise. It's a pleasure.
Yeah.
No, but you want to get that exercise. You want to get the heart pumping.
But still, biking is great, and there are small hills, which it's fine with the kids.
Yeah.
I'm not a professional biker, so.
Oh, but very nice. And we're going to get to a lot of questions tonight because I know last time you actually took almost all the questions away from the other two doctors. So to try and bring challenges to the questions,
Okay.
you have Dr. Scanzo, who's a cosmetic dentist,
Yes.
right? And you do general dentistry as well.
Dentistry.
And he brought a lot of things here to show. I just want to give a warning. If you're eating your supper, you might want to turn it off for a minute. But I see some pictures. Maybe briefly show us what we're looking at here.
Steve, I brought two things to talk about. One was veneers. It's a cosmetic situation. This patient actually has a lot of spaces. They had orthodontics to evenly space out the teeth. So they wanted to fill in the spaces.
What's the name of that guy?
point.
Stacy Keach? With that thing out there? He made a lot of money off of that. Yeah?
Absolutely.
Yeah.
So these are the teeth when they're prepared. We just lightly file the edges of the teeth down. We take an impression, and it gets sent out to a lab.
Does it hurt at this point or no hurt?
No injections
Okay.
at all. The lab makes these little veneers. Okay, they're very thin. You can actually see right through these veneers. And then these veneers get bonded onto
Wow.
the natural teeth.
Amazing.
So then you have that.
And this is what the guy we saw originally, or the woman that we saw?
Yes, before and after.
Let me see that before and after. Maybe the camera can zoom in on that. Look at that. That's amazing.
go.
It could change your whole life around. The teeth can hold you back,
It's
right?
definitely life-changing.
Start getting dates, you go out, it's nice. You don't know what could happen. So,
And the only other thing I brought today, a lot of people are interested in implants. If they're missing teeth, have no teeth at all, this is actually a replica, a big replica of an implant. Okay, this is the part that actually gets screwed into the bone.
does that hurt?
Painless.
Amazing.
Really, you get an injection, just a regular injection, and you don't really feel it at all. This gets screwed into the implant, and this sticks up above the gum. And then you put a crown on top of this. So this demonstrates that's actually the size of the implant. And you take a crown and you put it right on top of the
I hope
implant.
you can see that at home. It's amazing. It's not even that big, and it
And
looks
you can't
like a
tell.
real tooth.
It absolutely looks like a
And
real
it functions like a real tooth?
tooth.
Isn't that a complaint
unbelievable.
that people have with teeth that may not be real, that they don't chew as well, they have problems with it?
Sometimes
Whistling noises?
people, well, as that person can't whistle anymore, we filled in the spaces over there. But people with lower dentures, you could put 2 implants on the bottom, and you have a denture that snaps onto these implants, and now
Do you take this off when you
you
sleep?
need to try taking that out.
Okay, let me try it.
Oh.
So it stays in
Yeah,
pretty
it's,
well.
it's tight.
So you leave it on at night, or you put
You
it in the
should
jar?
take it off at night. You should take it off. Let the gums breathe.
You soak
brush
it in
the
a glass?
gums. Yes, soak it in a glass. Brush it. Treat it just like your teeth. You want to brush it, you can soak it in water. And
That's
so
phenomenal.
those are 2 big things in dentistry today: implants and cosmetic.
I think we'll probably come back to these as people call in, and we
Sure.
can point them out. So those at home with any kind of teeth problems, you got your man right here to call in. And then Dr. Backash, she's been with us so many times. A pleasure to have you back. And
Thanks for inviting me.
I know you have a dog at the beginning of the summer, right?
Yes, Abby.
Abby.
Yeah, she's a very pretty dog. She's a standard poodle.
And you did your family go out to the island while you stayed mostly in Brooklyn, or were you all in Brooklyn this summer?
Yeah, they stayed. I was back and forth pretty
That's
much.
nice.
But yeah, it's pretty out there. It's very
Summer's nice, but the fall it brings some nice things as well, and actually some heart problems we're going to talk about that may occur in the fall, and dental problems as kids get their teeth knocked out playing football.
Absolutely. Soccer,
I don't know if
football.
you've had any issues like that, but you have boys, I know.
Well,
so-
yeah, actually,
Go ahead.
I did have a couple of issues. One of my sons, of course, they're very active. They play a lot of sports. One of them had a couple of both of the young ones had chipped teeth. And
This is
they
just boys.
yeah.
You can't stop it.
Yeah.
But anyway, let's go. We have Loretta, who's on line 1, our first caller. Possible answer to the quiz, I hear. Loretta?
Yes,
Now, I don't know. There's a rumor going around you might have the answer to the quiz.
yes.
Okay, the question was the name of the president who has the most number of cities named after him.
And it was Jefferson.
Oh, it's so close. Yeah, it's so far away, as the song goes. You were very close. It's not Jefferson, but you were right there. You were fourth place.
Oh, okay.
Oh, but great guess. Do you have any medical issue?
I got a lot of medical issues, but
We keep you happy. See, we keep our listeners happy on the show. But you okay?
Yeah, no, I got a very big cold right now.
There is a cold going around. It's not the flu, right? With a little runny nose, sore throat.
Yeah, right.
So-
Bronchitis.
Yeah. So anyway, we hope you feel better
Okay.
and be well.
Oh, thank you.
Okay.
Bye-bye.
Ooh, a lot of sigh of relief out there from other people who have the question. Let's go to we'll go to line 2. Hi.
Hi,
Hi. How are you?
I'm fine, thank you.
Hi. Where are you calling from?
Manhattan, the Wall Street area.
Oh, very nice. Very nice. And what can we do for you tonight?
I had a question for Dr. Backash. My grandmother was due to get the flu shot on Thursday, but this week she started developing some flu symptoms, and she was just wondering if she should still get it or if she should not get it.
Right. The advice I usually give to patients who have some sort of illness and they're presenting themselves at the doctor's office to get a flu shot is that if they're acutely ill from some other infection, I tell them to wait until the infection has resolved and then, come back and then get the flu shot. Chances are nothing would happen, but I wouldn't want to complicate, the present, illness. If the patient is somewhat, if their immunity is compromised or if they have some sort of febrile illness, I'd rather wait until they get better. So I would tell her to come back in 2 weeks and then get the flu shot. The general flu shot, not H1N1, because we're not giving H1N1 to geriatric population. Only the
not?
seasonal flu shot.
She wanted to know why not to the geriatric population.
Well, the thinking is that H1N1 is not going to affect the older patients, but the patients under 50 years old. So it's felt that patients who have lived in the 50s and the 60s had prior exposure to this similar type of virus, and they have some partial immunity to it already. So the Department of Health is telling us to concentrate on younger patients for H1N1 vaccine and not the older patients. So she would only be a candidate at this point for the seasonal flu vaccine.
Okay, thank you.
Interesting.
You're
Thanks a lot. Call us back. We're now going to go to Mary, who might have an answer. Hi, Mary.
Yes.
I know you've been holding on patiently. Do you have an answer to which president the most number of cities have been named after?
I said John F. Kennedy.
John F. Kennedy is so close. The most number of memorials for John F. Kennedy, but not cities. So had the question been memorials, you would have had the new plaque. Oh. So do you have any medical issues?
No.
This is interesting. But I thank you for the call.
Okay.
And call back next week.
Okay.
Okay.
Bye.
Thanks again.
Bye.
See, people forget their medical problems when they hear the show. They play the quiz. That's the beauty of this. We'll go to Michael. Hi, Michael.
Hello.
Hi, Michael. Where are you calling us from tonight?
Gray's Inn.
Great Neck. Very nice. How are things out in Great Neck tonight?
Pretty good.
Did the leaves start turning yet?
Sure.
Very nice out there, right?
Mm-hmm.
So what do you like to, I always like to, haven't been out there to eat much. Which is the nicest place out if I want to impress somebody?
You have Joe's at Avenue U, and you have Florentino's.
Oh, I thought you were in Great Neck.
No, Gray's Inn.
Oh, Gravesend. Oh, okay. But I like that Fiorentino's. Very nice place. What's Joe's?
Joe's at Avenue U.
On Avenue U.
Yeah.
Okay, that's also for a light meal or a big meal?
Light.
Very nice.
Mm-hmm.
What can we do for you?
Well, I have a pain that comes from my upper thigh that radiates down to my foot.
Okay. How long have you had it?
A couple of days.
And how old are you?
46.
Okay, I'm going to ask Dr. Backash to take that one.
Okay.
Sure. The upper thigh, it's on the front of the upper thigh?
Yes.
Okay. The front of the upper thigh has, it's innervated. There's a nerve that goes there called the lateral cutaneous femoral nerve. If there's any injury to it, you get pain and numbness and burning and tingling on the front and a little bit on the side of the thigh. And it can go down the leg. It's more common in patients who are overweight or, and actually with recent weight gain, or then they can have a pinched nerve there. That's one possibility. The other possibility is it could be referred pain from your hip. The hip joint is you feel it in the groin. It can radiate down to your knee or your thigh. And of course, if it's going all the way down to your foot, that suggests that it might be a nerve from your back. So it's really hard to tell you, but that's the differential diagnosis. It's either from your lower back, your hip, or a superficial nerve. So I'd have to know more information. Does it hurt when you walk?
No.
No. And would you characterize yourself as being overweight? Or?
Well, I'm 6'1", 245.
Mm-hmm.
Yeah, so you're a little overweight. It could be just, you could have some trauma to that lateral superficial cutaneous nerve. Do you have any back problems or any?
No.
No. Okay. Yeah. So I would just wouldn't rush to do anything right now and just try to treat it conservatively unless it's affecting the quality of your life, and just I'd just wait it out. Take some non-steroidal anti-inflammatories. If it doesn't go away in a couple of weeks, I'd seek medical help with your local doctor, and he might want to do some imaging studies.
Okay.
It's always a good idea to lose a few pounds. That can sometimes improve the pain almost right away. So if you could lose 5 to 10 pounds, probably a good idea.
Yeah.
Right. I also may have an answer to the quiz.
Oh, you ready to? Okay. Little drum roll. Wait. Okay, what's the president?
Washington.
Oh, in the top 5, but not the answer. But thanks a lot.
Thank you.
Take care.
Bye.
We now got Ruth. We have Ruth. Hi, Ruth.
Yeah, hi.
Hi, where are you calling us from?
Brooklyn, New York.
Which part?
Bensonhurst.
Oh, Bensonhurst. How are things out there?
Great.
Yeah. What do you like to eat out in Bensonhurst, Ruth?
We would like the Paradisia.
Oh, nice. Where's that?
At Beth Avenue and 20th.
Who's the person I should ask for when I go in there?
They're all nice. When you just walk in the door,
They'll know me?
They'll know you.
All right. Thank you. Give a call ahead for me. What can we do for you?
I'm going to ask a stupid question, but I don't even think I could be helped. But just hearing him talk about those teeth, right? Unfortunately, I don't have no medical coverage, right?
Okay.
I had 3 sets of teeth. I had fallen a long time ago, and the front of my mouth, I broke all my teeth. They took them out when I was a kid. I've had 4 sets of teeth made, right? Unfortunately, not one has fit me properly. I destroyed almost my whole life by sitting in the house, because only when I have to go out someplace that's important do I put them in.
Okay, so we have a problem of multiple ill-fitting teeth.
Right. But
Okay.
I would love to hear what this doctor has to say, where I could go that's inexpensive to have that done.
Okay, hang on. We'll get Dr. Scanzo.
Well,
Thank you so much.
Ruth, it's a problem with a lot of patients with dentures, especially lower dentures don't fit too well. These lowers or uppers?
Uppers.
Okay. There's a couple of different things. Have you used any of the denture adhesives?
Yes, I
for it?
have. You name it, I've used it.
Then if you're comfortable with who made the dentures for you, basically your next step is to look into what's called the implants, okay?
That's what I was, I saw you
You'd have to have a
talking
couple
about
of implants placed, and there's actually some snaps that can hold the denture up for you. Where you can go, New York Methodist Hospital has a great dental department there.
But let's get down to brass tacks. How much is that going to cost her if she needs to have this?
At Methodist?
Yes.
think an implant goes for about $750 per implant.
Per implant.
Per implant. Okay, that's it.
Could you get any discount being an ask the doctor
Per
listener?
We'll see.
But that's a lot of money. I mean, it's well worth it when you
Per tooth? What's that? Excuse me.
per tooth.
Oh, my
Per
God.
implant. But you only need like 2 implants to help retain a denture. You don't need an implant per tooth, especially somebody that has a full denture already. You just need 2, maybe 3 implants to help support the denture. And sometimes you can actually use your denture with the new implants that you had. So you may not even need to have a whole new denture made.
So I might be looking at $1,500 in that range, $1,500, $2,000.
Yeah.
So I mean, it's something when you go in and take your car in, they're going to get $1,000 from you for the brakes. This is something that's going to last you
And
forever.
quality of life, being able to chew, smile, talk.
Right. But is she how does she know if she's eligible for this process?
She needs to be examined, okay, have different types of x-rays taken, Panorex x-ray, a CAT scan x-ray.
So Ruth, there is some, I guess, work that has to be done beforehand to make sure it's going to be successful.
Absolutely.
So Dr. Scanzo's number's up there. And,
Right. And he works at a Methodist hospital?
he works at a Methodist hospital. Yes, one of the hospitals that he covers, yes.
I'm very familiar with it.
It's a nice
Methodist.
hospital, yeah.
Oh, yes,
beautiful.
I'm very familiar with it. My grandchildren were born there.
Very
There you
nice.
go.
Were you born there, Dr. Backash?
Yes, I was born
Dr.
there.
Backash was born in New York
I was born
Methodist.
there. I'm still there.
So come drop by and say hello when you come there, okay?
Oh, yes, I will. Thank you so much. When you go to the restaurant, you mention Ruth.
Ruth? Okay,
Yes.
I'm going to mention. Thank you very much.
Okay,
Okay. Hi, Joel. Hello. I hit Joel. Joel usually is the first caller of the day. He's not there. Okay, Joel, call back if you're on the line. I have to turn to Dr. Nikita. A lot of guys are going out and gals are going out to exercise now. I see them in the park early in the morning, but there's a big change in the temperature. Instead of 80 degrees, it's now 40s and so on. Any special precautions or worries about people going out early in the morning in the cold weather to jog?
The people who mostly exercise all the time and they consider themselves healthy people, probably there is no specific precaution as long as you are drinking and make sure you're not dehydrated, even in the winter, because people sweating a lot even in the cold weather. For those people who have a coronary artery disease, who has an angina, it's very important in the cold weather, in extreme cold weather, to have some precaution, like prepare themselves before going outside, maybe warm them a little bit for a short period of time. What happens when they go outside in the cold weather, all vessels constrict and there is decreased blood supply to the heart, and it's already damaged blood supply, so it makes it even worse. So they may suffer shortness of breath or even angina. So what I would do, if it's very, very cold, and the days where it's cold, and the people who has a chronic disease should probably stay inside.
Stay inside on a
right,
cold day.
yeah, it's very extreme
Now, what
cold.
about Dr. Scanzo? This man went in swimming this morning in the Atlantic Ocean,
Unbelievable.
and he swims in the winter too?
Going once a month.
You're not one of the polar bear guys.
Not an official polar bear, but
What's the official bathing? You don't wear the Speedo. No,
no,
good, thank God.
no.
So that would bother me more than the teeth. But so how was it this morning?
strong currents. Water's definitely getting a little cooler, and the air's getting cooler. So
Is that good for you, Dr. Nikita? Is that a good thing?
He's trained, so once you train, it's probably fine. And again, for people who just decide to start swimming in the cold weather, you have to see the doctor first of all, make
should
sure
get
it's
checked out before,
checked
yeah.
up.
Thanks a lot. We'll go to our next call. We have Elizabeth, who may have an answer to the quiz. We're jumping around this quiz. Hi, Elizabeth.
Hi, Dr. Garner.
There's a rumor that do you have the answer to this quiz, do you think?
Well, I thought about it very carefully, and I think it's Madison.
Oh, this is, I mean, you can't hear the drum roll and the music because we don't have it.
Is it Madison?
It is Madison.
Yeah, that was my first thought. I thought about it, Madison, Wisconsin, Madison, some other cities.
That's
yeah,
amazing.
so that's great.
21 cities named after James Madison.
Yeah, I believe that.
And a high school, right?
Yeah, I learned that in high school, sure.
Right. Did you go there?
No, I didn't.
No. Did the caller go there?
I can't hear you, what?
Where did you go to high school?
I went to John Adams High School in Queens, but I'm from Rockaway.
Oh, very
Rockaway
nice.
Right now.
So now you, as a winner, you have to stay on the phone to get your the information. Then you're going to get this plaque. There are only 9 of them in existence right now.
That's great. But I have a medical question for Dr. Nicotina.
Okay. Why don't we hear it?
Okay. In July, I had a medical procedure, and I had to have some Dopplers done. I didn't have to, but I wanted them done. You know, the legs, and I had a sonogram of the heart. But they found a little slight blockage in the carotid artery, And I was just concerned, even though my doctor said it really was a very slight blockage and that should continue to take the baby aspirin because I've been taking that for a few years. So I just wanted a cardiologist's opinion about the blockage or how serious could it get worse.
That's actually an excellent question because many people do have a blockage. It's very small. We call it plaques, and it's not obstructive yet. But the reason why we're actually looking for them, because why we initially do the test, because this vessel is representing a whole system in the body. So if we notice any plaques in the vessels of the neck, it represents vessels everywhere in the heart too.
Right.
It means that there is already a process which is called atherosclerosis, small plaques growing everywhere. It means that you have to take care of right now what's going to happen in the years because of high cholesterol, high blood pressure. I don't know if you have this. These plaques will grow.
I have hypertension. I'm 60 years old now. The sonogram of my heart was good, and the Doppler of my legs was fine, and the cholesterol was okay.
Okay is a misnomer, actually. There are a particular number which we are, as a doctors, actually want to have a cholesterol if you already have a plaques. For people who do have a beginning of atherosclerosis, cholesterol should be perfect. And there's bad cholesterol should be below 100.
It was okay.
Again, if you are taking baby aspirin, it's probably good enough, but I prefer all my patients who already have a beginning of atherosclerosis taking medication for cholesterol, even if the numbers appears to be normal. But those medications, we call it statin, they actually in the long term prevent from these plaques grow and rupture, and rupturing of the plaque leading to the heart attack and strokes.
Right, that's great to know.
Hope that helps you. Stay on the phone so we can get the information. The plaque will be speeding to your house.
Thank you so much,
Fourth class
Dr.
mail,
Bennett.
but it takes a week, but you'll get it soon. Okay, thank you. We're going to go now to Pat. Hi, Pat.
Hi, Doc. How are you?
Pat, where are you calling from?
Bensonhurst, Brooklyn.
How things out there? Do you know the restaurant that Ruth was telling us about?
Yes. It's a pretty good restaurant, but I happen to like the Tommaso's a little bit better.
Tommaso's. Who's the maitre d'? Who's the owner, maitre d', right?
Yeah, he's sort of like the quasi-opera singer. He sings opera.
The opera guy, right.
Yeah, the food's very good there, and I happen to enjoy it.
If you give him a couple of dollars, he stops singing. Yeah, just a tip in case you go in there. So what can we do for you tonight, Pat?
Well, Doc, I have a question. About 2.5 months ago, I hurt my back, but I also hurt my neck, my middle back, and my lower back. I've been going to a chiropractor. I also have 3 stents. Okay, I have some numbness down both my thumbs, my index fingers, the top of my forearms. Sometimes after I rest, it gets less. When I work, I've been working every day. I haven't been able to really rest my back to heal it properly, and I've just been going to the chiropractor 3 times a week. Would my heart have anything to do with this numbness?
Just to recap, I understand you've had
a pinched nerve in my neck.
You've had 3 stents. You have numbness down the arms when you worse in exercise, better at rest, and you have back pain up and down. So I think we got two doctors that want to address that.
Sure.
Dr. Bakesh.
Yeah, the numbness in the fingers on exercise, may not necessarily be related to your heart, although that would be the first thing you would want to rule out, because obviously you don't want to have a cardiac event that that could kill you. So you would have to rule that out first by doing a stress test.
Yeah, I'm doing for my stress test about now with the Cardiology.
And if you can't exercise, they could do it in a way in which you don't actually have to exercise. They can do a pharmacological.
Is that the percentine stress test?
Right, the percentine thallium. Okay. So the fingers usually due to a disc disease in the neck. Usually that's the 6th cervical vertebrae. And that indicates compression of the nerve at that point. So that's usually treated conservatively, physical therapy. And if the imaging studies like an MRI of the neck show compression of the nerve and what's called a spinal stenosis, where the disc is actually pressing onto the cord, then you might need some more aggressive surgical intervention, which would be done by a neurosurgeon. But certainly that's... Yeah.
I tried calling last week. You had a orthopedic doctor on, and I couldn't get through. But I was worried. I really don't think it would stop my heart.
Pat, I want to address that issue because I'm concerned. I want to know what Dr. Nicotina thinks. If this could be related to his heart.
If someone experiences a symmetrical problem, if you mentioned both arms involved, it's probably mostly related to the spine or nerves in the back. If it's on the one side, then you have to look from a perspective of a vessel disease, because sometimes there are problems with the vessels which supply blood to the arm, and if there are blockages there or narrowing there, it can create numbness there too.
Pat, you said you had 3 stents. Dr. Nicotina, could you tell us, the audience that may not know, where do the stents go?
The stents goes in the vessels of the heart. If there are blockages in the vessels of the heart and the person experiences symptoms such as discomfort with exertion, we usually take care of this with a stent. It's a little
like a tube?
Like a tube goes inside of the vessel and keep it open.
It's like a Chinese finger, sort of.
Yeah. So I'm glad that, it sounds like a lot of the problems may be related to nerve, back, back, and maybe not heart.
I also have pains plus the lower back, but I also had it because I got nervous because I heard that you can have back pain with, when you have heart disease,
Yeah.
But I've never experienced that. I never had a heart attack. I always got caught, the arteries got caught prior to any heart attack, thank God, and so I was just nervous because this numbness is like from my elbows down. It's weird.
Sounds like we got to get x-rays.
On both sides, too.
We have to get some x-rays, so your doctor can order them. We can do them at Methodist if he orders them, or any way you get them done, and we'll take a look at them for you.
Well, doctor, I was also looking for a new doctor for my regular medical physician. My doctor in Staten Island, every time I go, it's like a 5-hour wait. And he's a great doctor, don't get me wrong. But I was looking for somebody new. How can I go about finding new, maybe, I don't know, internal medicine, and, with some kind of doctor?
Why don't you give a call after the show? I'd rather talk to you after the show, and I'll give you the name of a couple of people to try.
Very good.
Okay? Thank you. Thanks a lot. Call back after the show.
Thank you.
Thank you. I just wanted to, one of the things that I know, plaque disease in the mouth, the gum disease, and heart disease, some connection there.
Yeah, there is some connection. They're finding more and more of a connection between a lot of different problems. The plaque that builds up in your mouth can get the bacteria going into the blood system. And
so how often should somebody clean their teeth? Go to the dentist for cleaning?
Twice a year, minimum.
And how many times should you floss a day?
Once a day.
Once a day?
Yeah.
Have you noticed that the studies you're reading that show some connection with heart disease?
There was a couple actually studies, and there were. It's still unclear. Is it because of an infection causing the inflammation, causing heart disease, or people who are unfortunately don't have a proper care of the dentures and the teeth, then they ended up having a poor quality of care from doctor's care.
Good. And let's move on. I see we have Joel back with us on line 4. Hi, Joel.
Oh, hi, Dr. Garner.
Joel, we missed you. You didn't make it today to the front.
It's been a rough day. I couldn't get in first. I got cut off. It's been one of those days.
I thought it was Maddie sabotaging the line, but she didn't call either. So, what can we do for you, Joel?
Well, I got a question for the dentist, Dr. Garner.
Okay.
Sure. I'm a good-looking guy. Not as good-looking as you, but my teeth are all crooked. And I heard about this Invisalign. And I want to know what my options are. They don't have the spaces like you showed at the beginning with those pictures. They're all stuck together. It's hard for me to floss.
Right. Joel, Invisalign is a great new device out there today to move teeth. If your teeth are crowded, you may need to have some disking done to make space. You may actually even need to have some teeth removed to make some space. But you can definitely need to check out with an orthodontist. I'd see your primary dentist first, your general dentist. He can refer you to an orthodontist, and Invisalign is a great way to go today.
Okay, thanks. Maybe one day I'll be as good looking as Dr. Garner.
Well, anyway, you can hope you win the quiz. I think I would aim for the quiz. So,
all right, thanks a lot.
Thanks a lot. And I see we're going to take a break. We have to pay some bills. We'll go out to our sponsors, so don't go away. Watch the commercial, and then we'll come back. The phone number is 718-499-6101, and you can call and talk about heart disease, oral health, and geriatric medicine. So we'll take a short break. We'll be right back, though. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor. Our topics are heart disease, oral health, and geriatric medicine. With me again, I have Dr. Anastasia Nikitina, Dr. James Sconzo, and Dr. Emil Bakash. And the number to call is 718-499-6101. Now let's get right back to the phones. And we have Cheryl who's been waiting patiently. Hi, Cheryl.
Hello.
Hi, where are you calling from?
I'm calling from Flatbush, Brooklyn.
How are you doing tonight? You sound a little sad.
Oh, no, I'm not sad. I'm all right.
Okay, that's good. I want to hear that smile. What can we do for you?
Well, I was calling about some swelling in my legs, and I wanted to see if I can get an idea about what was going on with me. I've been always had a problem where I've been losing protein from the time I was like in my 20s.
How old are you?
Huh?
How old are you now?
I'm 53.
53, and how tall are you?
5'6".
And how much do you weigh?
About 296.
Too nice. So there's definite increased weight there. There's it's obesity actually, and what we want to do is ask Dr. Nikitina first to start off about what could cause swelling of the legs and how that might relate to low albumin and protein.
Oh, okay. But but with losing protein, I've always had the problem. I wasn't heavy then.
Right. So we're going to tie this in. I want to just give the pictures to the audience so they can picture what we're talking about, and then. I know that the obesity may not be from eating too much. It may be the swelling and so on, but we'll ask Dr. Nikitina.
We'll just stop on two things. There are vessels in the legs, veins and arteries. And usually problem with the veins are happening with the age. The valves in the veins the vessels of the veins brings the blood to the heart. So if there's any problem with the weight, extra weight carrying and extra effort necessary for veins to bring the blood up to the heart, it can stay down there in the legs and create the swelling. If you have this problem for a long time, again, we need to make sure there's no problem with the arteries and make sure there's no problems with the veins. Other problems, medical problem, can cause a leg swelling, but more acutely, it's probably lung disease, some of the lung disease. And as Dr. Garner mentioned, kidney disease and liver disease can cause a leg swelling too.
So, Dr. Back, you're seeing a lot of patients coming in with renal disease and the swelling that we're hearing about from Cheryl.
Sure. I mean, the protein loss, presumably is from some chronic kidney disease, and that can cause a syndrome called nephrotic syndrome, which means that your legs swell up, your serum albumin levels are low, and you get what's called third spacing of the fluid. It goes into anywhere it can find a space because the pressure inside the blood vessels is low because there's no more protein that holds the fluid in the vessels. When it's low, it goes outside. So the treatment is really based on treatment of the primary disease that's causing it all. So if it's a diabetic kidney disease, then you would, treat this, diabetic nephropathy, with a low protein diet. It's counterintuitive, but you take a low protein diet and you have to go on drugs that are called ACE inhibitors, drugs like enalapril and drugs like that. There's also protein losing nephropathies that aren't related to diabetes, which are treated with immunosuppressive drugs, which, if it depends on what kind of kidney disease you have. If sometimes they even do kidney biopsies under CAT scan guidance to determine what kind, whether it's a, glomerular membrane type disease, if it's a, bumpy or linear antibody deposition on these parts of your kidney. So there's a proper medical workup for it, and depending on that, goes the treatment. So there is treatment for it, most certainly, and I think it's the nephrologist would be best adept with your internist on focusing in on the exact cause and then the treatment.
Cheryl, in 2 weeks we have a nephrologist on the show, so you can watch then. What treatment are you taking right now?
Well, right now I'm not taking any type of treatment.
So we really need to get you in. You need to get in and see your...
You need to be treated. because it can really prolong the life of your kidneys if you decrease the amount of protein. If you continue to leak protein, your kidneys will not last as long. So it's very important for them to decrease the protein production and treat you, and you'll do much better. You'll feel better too.
So Cheryl, please call. You can call Dr. Backash, call your own doctor, and ask him for a workup. But you need to get some bloods drawn and figure out what's going on here.
All right, thank you.
Okay. I hope we hear back from you in a week or so. Okay.
All right then.
Thank you.
Thank you.
Let's go to Sally now, and Larry's on deck on line 2. But let's go to Sally first. Hi, Sally. Sally.
Hi, I'm here.
Hi. Where are you calling us from?
Mill Basin.
Oh, very nice. Very nice. How's that Mill Basin deli? Is it still good?
Oh, delicious.
He's got this artwork, right? What is that? How do you say that? The artist that he's got? Urte or something?
I don't know his name.
Urte. Yeah, you feel good because you feel you're seeing some culture and eating a delicious pastrami, right?
Pastrami, corned beef.
Ah, sounds delicious. All right, what can we do for you?
Hi, I wanted to ask a question about the implants.
Okay, we've got Dr. Scanzo. Sure.
Right. You said it was $750 for the implants, but is that including the cost of the post and the crown?
That's at Methodist Hospital, okay? And that's just the cost of the implant. The cost of a crown at Methodist, I think, don't hold me to it, but it's just about the same thing, about $650.
Oh, so it's another
additional, yes.
So it's about, we're talking about $3,000, $4,000.
$1,300.
$4,000 for one tooth?
$1,300.
So
$750 and $650.
Okay. And that $1,300 covers more than one tooth?
No, that's for a single tooth.
Okay.
That's if you're replacing, one tooth. Not as the denture like I showed before.
Okay.
That's just replacing a tooth.
So $1,300 per tooth. But you have a tooth that lasts. That's
20, 30 there.
Have you found that experience, these prices, to be about what you found?
No. The dentist that I was going to, it's about $2,500 a tooth.
Yes, that's in a private office setting. This is at Methodist Hospital, which is a dental department at Methodist, and some of the other hospitals have the same thing. You're definitely talking a 50% discount rate.
That's great. Sounds very good.
Definitely. So how would we make an appointment to come see you?
You'd call up Methodist Hospital and the dental department there, and they'll set you up.
Wonderful.
Yeah, and who would do the procedure? Would you do it?
It's actually the residents there.
But this closely screened.
We're standing right next to them.
I went myself to Dr. Scanzo actually before I went on a trip, and it was amazing. Just the courteous behavior of the residents. It was a pleasure to deal with them. So I highly recommend it.
It's a great
I'm definitely going to try it.
Very good.
We'll see you there.
Thank you.
You'll send us in a smile when you get it, okay?
Of course.
Okay. Thank you. Thanks, Sally. Larry, hi. Larry?
Yes.
Is this the Larry from Rockland County?
Yes, Dr. Garner. How are you?
I was getting nervous you couldn't get through.
Well, I was having a little difficulty. But I would like to speak to Dr. Nicotina.
Okay.
If I'm pronouncing it correctly, about some medication. She mentioned cholesterol earlier. And I've been taking some simvastatin, but I've been reading that simvastatin can cause as many problems as it's supposed to cure. And the reason I raised the issue is I'm also a diabetic, and I was reading just recently that Lantus insulin, which had been, cheered, they did 4 studies with it, and they found that it's can be leading in the direction of cancer causing. So although the simvastatin is being cheered, I'm just wondering if some of these other physicians that I've been reading who've been saying that there are other ways of dealing with this thing might be in the right ballpark.
Thank you for your question. Actually, I'm always telling to my patient that all medication, yes, they do have a side effect. This is why we inform in the beginning. And simvastatin per se is one of the oldest medication. It was on the clinical trials for many, many years, probably more than 20 years. One of the first medication which was tried with the people with diabetes, and at that point of time it showed decrease risk of heart attack and stroke. since we know a little bit more from the beginning of the medication, since we have data on this medication longer than other medication, I don't feel particular that one medication actually more dangerous to another one. Simvastatin, again, was probably one of the longest medication on the clinical trials, as well as atorvastatin, which is a generic name for Lipitor. And at this point of time, I don't think there is any reason for alarm. And especially if you have diabetes, you have to take medication to decrease your cholesterol. And I per se don't have any different. I mean, I don't feel a preference among all this medication. But again, the longer medication existing, the more information we'll have, which is helpful for us because we will advise you in the future: is there any potential danger or not? But I don't think we need to be alarmed at that point of time.
Are you familiar with these Atlanta studies that I spoke about?
Yes, exactly. Yeah, I know what you're talking about. But again, there are many things which may happen by chance only, and there needs a longer, probably clinical trial, longer follow-up on those patients. What happened?
It's interesting.
Yeah.
Again, no medication you take doesn't have some kind of side effect. Anyone does, so you want to take as little as you have to, but in this case, being a diabetic, it's critical that the cholesterol be properly controlled.
We always measure what's the risk and what the benefit, and knowing that the chance of having heart attack in the next 10 years in the people with diabetes and high cholesterol higher than the potential 1 in 1 million chance of having cancer.
I went to Dr. Bacchus. I know you wanted to say something.
Sure. I mean, you had mentioned that you were concerned about that simvastatin and the statins in general can contribute to the formation of diabetes. Well, there was a study out like that. But I think you got to look at your risks of developing atherosclerotic heart disease. And I think if you have any concern, it's very important to change that medicine to a different medication and change the Lantus to a different type of insulin, because right now the answers aren't in. It's very possible that that is true. And there are other insulins that you can change to. So it's not worth worrying about right now, but I would change it anyway.
Interesting. Thanks. Always great questions.
Okay, I appreciate that, doctors. Thank you very much.
Thanks a lot, Larry. Take care. I just want to have one myth that you may see. There's a lot going on the internet, vitamin D preventing influenza. I don't know if you guys have seen it. This has not been proven in any way. I would definitely not say I'm going to take enough vitamin D so I don't need a flu shot. So don't get taken in by that. And the vitamin D, there are harmful effects to taking too much vitamin D. So always consult with your physician before you start. It's all over the internet now, selling vitamin D. So, okay, Luz?
Yes.
Hi, it's a nice name. What is the Luz?
Luz, I'm Luz.
Luz, hungry.
Yes.
Very nice. What does it mean?
Light.
Light, beautiful name. Light.
Thank you.
Light from Hungary. What can we do for you?
Yes. How are you, doctor? I know you for so many years. I keep all your the tablets or everything that you had written. I had cut it, and I have a whole file.
Oh, thank you.
I'm so glad I'm saying hello to everyone there. I had a stent done to me 5 years ago. One. And after that, I had gone to the doctor many times. But when he told me that I may need one, where I don't feel any symptoms at all, I feel very good. I play tennis, and I go to exercises. I go to yoga, and Plavix, and an aspirin. Also sit here and Lavalitol. Those last two ones, I just wonder, why do I have to drink them when I don't have any blood pressure or any cholesterol? And
so the question is, I don't feel any pain. Why am I getting the? What do I need this?
Right.
Okay, let's see what Dr. Nicotina says.
Can I ask you a question? Why was it recommended to have another stent?
Well,
Did you had any?
you have to have another test because I didn't pass the last stress test.
So you had a stress test which showed that you still have a problem.
Well, I don't have any pains. I feel well. The reason I went to the doctor 5 years ago is because I had a pain on my chest. But I so far with the medication, as a matter of fact, I don't even drink any painkillers.
Well, I want to ask you a question. When you had the test,
yes,
and they stopped it,
yes,
were you having pain at that point?
No,
So what would be some reasons they would stop a test for a patient without pain, stress test?
Again, I have to look at exactly what happened during the stress test and what point the doctor to recommend you to have another procedure done. In our practice, if you have a small changes, we call it ischemia. It means that there is a small area of myocardium which suffer from not enough blood supply. If you have a small area and you don't experience any symptoms, you can easily continue medication, maybe change the medication a little bit. If you have a significant amount of ischemia, but you don't have a symptoms, which is weird, usually there are some representation of shortness of breath or some chest discomfort, then I would talk to you about this and I would discuss what options can be. And still medication is a possibility to continue. And again, procedure of opening the vessel is also a possibility. May I ask how old you are?
Oh, gosh. Do I have to?
Oh, we were
Okay,
we won't tell
should
anyone.
I'm 82, going
Wow.
on 40.
82.
Again, if you feel perfectly fine and your stress test showed just small changes, then I think it's the right way to go, just continue your medication. But in order to make a complete decision, I have to know what exactly your stress test showed.
Okay, but thanks for the kind words.
Yes, I think I will go to Methodist and try the second opinion.
Excellent. Always get second and third opinions. It's very important when it comes to your health. And something doesn't sound quite right, we want to know a little bit more about what's going on.
Right.
So keep listening.
And, the thing is that I had both legs, someone had mentioned it, I had a lot of problems with them. They get cold, and they're so painful and cramps. The cramps, I couldn't drink anything because I'm allergic to so many little things. But I'm managing by not walking because I used to walk a lot. I used to walk 3 or 4 miles.
That's got to get corrected because it's important, and there are different causes. We've got to move on because it's only 3 minutes. But call back next week.
We have a bookstore here on Avenue T. Try it. It's one of the best.
What's the name of it?
Il Posto.
Il Posto?
Yes.
On Avenue P?
T and 69th Street.
Is there anybody in particular I could ask for?
No. Everyone is so lovely and it's such a beautiful atmosphere.
I'm going to say Luz send me, okay?
Yes, yes.
Okay, call back soon. And I hope to see you when you come to the hospital. Come by and say hello.
Okay, I saw Dr. Jacobson.
Excellent.
For torn meniscus, and I'm going to PT with him.
Okay.
Yeah.
We got to run, but have a great week. We'll go to Maria now, who's been waiting. Hi, Maria.
Hi, Dr. Gardner. How are you?
Hi. Sorry we have so little time, but I want to get right to the essence of the question.
Okay. I had a catheterization done 15 years ago. The first time, actually 10 years ago, when I was 40 years old. I was under a lot of stress, short of breathlessness, heaviness on the arm. Had it done, didn't find anything. 9 years later, I had it done again. I'm 49 now. I had it done again. I've been experiencing a lot of short of breathlessness and tightness in the chest. They did it again, and right there at Methodist Hospital. Actually, my husband works at Methodist Hospital. So,
where does he work?
My husband is a security officer there.
Oh, very nice.
So I had it done. And the doctor said that there was some weakness in the heart. That's all he said. So I went back to my doctor, the cardiologist who did it, who sent me for the test. And he did another, I think it's called no sonogram, where they look at the heart again.
Yes.
And he said to come back in 3 months. I'm still experiencing I had palpitations. I felt a lot of my heart racing.
Maria?
Yes?
I'm not happy with what I hear. There's a lot of questions in your story, and it's something I really hope you're going to call Dr. Nicotina because I think that she should evaluate you.
I actually made an appointment with her. My husband made an appointment for me to come in and see her because I am still experiencing palpitations and I'm still experiencing heart racing. So I don't know if it's due to perimenopause or what the case may be, but I am going to come in to see her.
Okay, and I want you stop by and say hello when you come in, too. I'd like to say hello to you.
I will. I will come in and say hello.
Okay, be well, and thanks for calling.
Okay.
Take care. I'm sorry we didn't have enough time to really do that justice. We have 2 more callers. Eston?
Yes, doctor.
Hi, Eston. How are you?
Fine, thank you, doctor.
Where are you calling us from?
East New York.
East New York, not beautiful. What's the story?
I'm calling for my daughter.
Okay.
She's 34 years old now, and about 4 years old, she fell down and hurt her ankle. And since then, up to this day, it has not been healed as yet. She's still using the crutches. I don't understand why. Could you give me...
Yeah, Dr. Bacchus, an answer.
Well, sure, it depends on what was wrong with her ankle. Did she break her ankle?
No broken, nothing at all.
No broken. So maybe she sprained it, which, in layman's terms means that the ligaments and the tendons may be torn and ripped. That can take longer to heal than even a plain fracture. So what can happen is that the swelling has to all go down, and then sometimes you can develop, some sort of reflex sympathetic dystrophy too. But if you're followed by the orthopedic doctor, and sometimes what he'll do is he'll need another imaging study, like an MRI of the ankle, to see exactly what's wrong, if there's some sort of anatomical problem that needs to be corrected. So if it's not healing, you have to go back to the orthopedic guy, let him take some films, and then decide what the next step is.
Eston would be happy to help you. We're rushing along quickly, to get to the next call. It's our last one. But
Okay,
please,
thank you very much.
call
Thank
us
you very
back,
much.
okay?
Oh.
And the last caller of the night goes to Peter. Hi, Peter.
Hi, Dr. Gunn. How you doing?
I want to get your question, so what is it?
Okay, I want to know, I know someone who's in their 80s and they're having a lot of leg cramps, mainly at nighttime. And we want to know, what do we do about it, and how do we know that it isn't blood clots in the leg, and, the difference between the two, and what do we do about the leg
Very
cramps?
good. I'm going to ask each doctor to take 30 seconds. Dr. Bacchus, 30 seconds.
Leg cramps in an older person, sometimes it's vascular, where they don't have enough circulation in the leg, or they have electrolyte problems from the diuretics or water pills they're taking from their blood pressure, or sometimes it's simply muscle fatigue due to inactivity. So the patient should be examined, the pulses should be felt or not. If not, they need Doppler studies, and then simple blood work to check the electrolytes, and that'll give you a good idea to start.
And Dr. Nicotina.
I completely agree, and I usually check magnesium level, because low magnesium electrolyte level can cause the cramps in the legs.
I really want to thank you, Peter.
Okay, thank you.
Hope to hear from you next week.
Thank you. Bye-bye.
Okay, we have to wrap up now. I can't believe it. This is it for this edition. It just flew by. I want to thank my doctors, Dr. Anastasia Nicotina, Dr. James Sconzo, and Dr. Emil Bacchus for coming in. We hope we were able to help you. It's good to remember, as we pointed out, that you must be proactive about your own health. Speak to your doctors, speak about your concerns, and go for second or even third opinions. In the meantime, continue to watch this show every Tuesday night, or visit the website at netny.net/askthedoctor. There you can catch video blogs, see past episodes, send in questions, or join our new forum. I'm looking for many of you in that forum. So I want to thank you all for your calls tonight, and I'll see you again next week with a brand new episode. We're going to be talking about internal medicine, general surgery, and psychiatry, both pediatric and adult. So goodbye, stay healthy, and I'll see you in the tablet.